I'm Craig Cooper, I'm the CEO of Positive Life New South Wales. The Positive Life Peer Support Program is for all people living with HIV throughout New South Wales. And what we do is we provide either one-on-one telephone support, email support, or support via Facebook and other means. So basically, peer support means people with HIV talking with other people living with HIV and helping them come to terms with diagnosis of HIV and how to navigate the health system or relationships in general. Once you disclose that you're HIV positive, taking back that disclosure and other people having that information is sometimes quite tricky. And how people can use that against you in terms of stigma and discrimination or treat you differently as a result of that disclosure, it's not always an easy thing to navigate. So having somebody living with HIV for a period of time support another person coming to terms with the diagnosis and how to actually navigate life and relationships in the health system, that's basically what peer support is about. When somebody is newly diagnosed with HIV, immediately one of the questions that will be asked of the HIV positive person or the person living with HIV is, can you think about any people that may be at risk of transmission, whether that be through sexual activity or through drug use? So basically, have you had unprotected sex with somebody else within the time frame that they suspect that you have been living with HIV and been undiagnosed, or have you been sharing injecting equipment and possibly somebody being exposed to blood, basically. So at that point, when you get the diagnosis, the clinician will say, we need to have a chat about what is called contact tracing. We'll need to have a chat about other people that may have been at risk of infection so that we can identify if those people need to go for a HIV test. The person who's coming to terms with the diagnosis of HIV, which can often be quite shocking, then we'll need to think back about people that may have been put at risk because of either sexual activity or drug using behaviour. They will then need to tell the clinician if they're going to take care of contacting those people and encouraging those people to go and have a HIV test, so to go and see either a GP, a sexual health clinician or a HIV doctor, or if they're going to actually give the names and numbers of those people to the diagnosing clinician or the clinician they're talking to, the doctor they're talking to, so that the doctor can do what is called clinician-delivered contact tracing. So working with people that may have been put at risk through sexual activity. Typically, anywhere between 60 or 70% of people will self-nominate. So they'll want to actually contact their sexual partners or their drug-using partners and let them know that there may have been exposure to HIV. So in that moment, that person can be quite isolated, working out how to say it to the person, what to say to the person, how to deal with their reaction, how to encourage the person to go to a service where they can have a HIV test, what they need to say, what that person needs to say when they turn up for a test to the doctor or whoever they're getting the HIV test from. It's it's a pretty intense moment. So having another person with HIV say, hey, this is some ways that you can go about it, it can be it can help alleviate some of the anxiety that's associated with that. There's a lot of sex that occurs in online environments, whether it be through mobile apps or through sex pickup sites. What we can do is we can go in and have a chat to people that are hosting parties or potential sexual contacts that have been picked up through those sites, and we can help people navigate those environments and people that may have been put at risk through picking up and having sex anonymously or through group sex activities. The other scenario around contact tracing or risk could be occurring for somebody who's living with HIV and has been for 10 or 20 years, and they get a diagnosis around an STI or hepatitis C. So in those scenarios, contact tracing is yet another issue where the person needs to work out, okay, who do they need to contact and talk to about the STI or the hepatitis C diagnosis, and who potentially could be put at risk around that. And there are a lot of resources around where to go for an STI screen and what to do around possible exposure to hepatitis C. We're developing scenarios and scripts and a checklist, what people need to think through and go through or think about when they're going to be contacting people that potentially have been put at risk of HIV. So we have a nurse, a HIV positive nurse on the team. So in terms of how to navigate and negotiate this arrangement with the diagnosing clinician, because sometimes that can be a little bit tricky. So that's why we have a nurse on board. So any peer in the organisation or person living with HIV can provide the support, but in particular we have a nurse who is a treatments officer that could quite easily be contacted either via email or via telephone. So the referral could come from the diagnosing clinician, or it could come through people looking up the website and working out what to do. Even though they can be really intense moments for people who are receiving a new diagnosis around HIV or STI, it can be really confronting and difficult to actually try and think about, okay, was that person put at risk or not? There are other things that people can do. You don't have to be alone in that moment, and this is about trying to work in a way with your sexual partners or your drug using partners so we can end HIV transmission. This is the point in time when somebody's is newly diagnosed with HIV. This is the point in time where we can identify the most people that have undiagnosed HIV and possibly prevent further transmission of HIV. So this is a really critical moment for community members so that they're not continuing to transmit the virus.